the Caprisa eThekwini Research Clinic, situated in the heart of Durban's bustling central business district. HIV prevention research and treatment is done here.
Currently, we are looking at multiple HIV prevention trials, including one that looks at the Depivirine ring study, as well as one that offers women Truvada, which is a tablet that can prevent HIV infection if you take it every day. So on average, we have about 20 to 25 women coming in to access Truvada every day. Men and women actually come through to the clinic.
Nompumelelo Ndleche is one of them and has been on the HIV prevention initiative PrEP for 3 months.
And I got interested because I am married to an HIV positive husband.
She's a 39-year-old who approaches life with vim and vigor and views PrEP, or pre-exposure prophylaxis, as a good preventative measure.
I believe that it's a great initiative for every individual in South Africa, especially young women who are failing to convince their partners to use condoms, who also don't want to talk about the issues of HIV with their partners, because in most cases, when that happens, it's because a woman is dependent on a man to provide, and PrEP is the best option for them. Rather, be safe, protect yourself.
Knowing your status is an important first step.
Professor Kiresha Abdul Karim is the UNAIDS Special Advisor for Adolescents and HIV. She says South Africa makes up less than 1% of the global population, yet 1 in 5 infections that are taking place globally occur in this country. But there have been huge successes. Just over 60% of people who are infected are on treatment, and in terms of preventing mother-to-child transmissions, the rates are down to less than 2%. But the challenge remains preventing new HIV infections. HIV-related stigma and discrimination are some of the factors that are hindering progress.
So what is driving the fear? What is driving the stigma associated with it? In a country, say if you're in a community and 60% are infected, I mean, really, if more people are infected than not, why would there be stigma, or why should there be stigma and discrimination? So I believe it's one of the biggest challenges that we haven't quite dealt with, but has to be addressed very actively and very aggressively if we're going to change the epidemic trajectories in South Africa.
There's a program that we initiated in KwaZulu-Natal that we are actually been excited that the minister is interested in, what we call youth user-friendly services. We had to admit that our facilities, particularly clinics, were not youth user-friendly. And there were nurses there who would say, why are you here? Why do you need preventive? Why do you need a family plan? You are too young. I'm going to call your mom, your aunt, and tell them. So we had to actually reorientate our staff members to say, look, these young girls are in trouble. They've actually made an effort to come to our facility because they know that they are sexually active. For us, it's not to judge, but to assist them.
Just like Nompumelelo, 21-year-old Sinatemba Mkunu's approach to life and health is pragmatic. She's been on PrEP for almost 2 years.
If you don't take charge of your health, no one will. You're the one who owns your body, and you have to respect it, and you have to know where you stand with it. No one can tell you what to do with your own body and your own health.
Blaine Herman, SABC News, Durban.